Anin Boujou, band members, today is Monday, August 24th. COVID updates for the counties. Aiken County, yesterday 1,450, today 1,456. Crow Wing, yesterday 7,188, today 7,230. Mille, yesterday 3,278, and today 3,305. Pine County, yesterday 3,517, and today 3,535. The reservation band member cases, District 1 and District 2A, 123. And there are no new band member cases at this time since we last reported. District 2, 12, no change, and District 3, 35, no change. Just based on these numbers, many of the positive cases in our surrounding communities and counties have been increasing rapidly. The U.S. Food and Drug Administration granted full approval to the first COVID-19 vaccine. And I think in the beginning, that's why a lot of folks didn't want to take the vaccine, because they felt that it wasn't or didn't have the full approval, but now it does. Today, I am attending the Minnesota Indian Affairs quarterly meeting. And what happens at the meetings is that the Lieutenant Governor and the commissioners provide an update to all of the tribal leaders. And they talk about new policies, COVID information, grant funding opportunities, things of that sort. And so Jan Malcolm, who's the Commissioner of Health, gave a lengthy update on COVID and really appreciated that. One of the things she talked about is that 96% of the positive COVID cases are based on the Delta variant. So that shows that when this disease mutated into the Delta 19, it really had a negative impact on our state. Also currently in the state of Minnesota, that 18% of the ages from 0 to 19 have been classified as positive for COVID, and that's for the state of Minnesota, 18%. And nationally, it's 14.4%. And also Minnesota kids 9 years or younger have doubled, and we're at a rate of 9.6 of those kids are positive. There's a lot of talk about that third dose, and that is considered the next step of the doses that we currently have. For instance, we were talking about you needed to have 2 doses of, when the vaccines were available for Pfizer and Moderna, it was recommended that each individual receive 2 doses. There is new information that there should be a 3rd dose as well, in addition to the booster shots. So as we get more information, we will share that. A lot of information out there that may be confusing for some. Hopefully that we get enough of the information out there that we all know what this means in terms of the 3rd vaccination or the booster shot. The CDC still recommends that those who have not been vaccinated get a vaccination. And the vaccines are very highly effective at protection from the virus and reducing the risk of going into the hospital. Commissioner Jan Malcolm talked about that it's very important that we continue to wear our mask inside buildings and also when we're attending large groups. And if you can, please keep a 6-foot distance from others and wash your hands often. So that is still one of the recommendations, that we follow those 3 steps, and hopefully that we can all do that. powwow this weekend. I want to say miigwech to everyone who ventured out to attend the powwow. And of course, a big shout out to our powwow committee and all of the volunteers who helped make it a success. And that is all of our employees, because it is an employee-sponsored powwow. So we're very appreciative of it. The fires continue to burn in northern Minnesota, the Mille Band communities. We're still under a number of air quality alerts, and that is due from the wildfires across the United States and Canada. And it looks like these conditions are going to be here until way into the fall. And of course, our DNR staff, Charlie Lippert, the band's air quality specialist, he will continue to monitor the situation and issue alerts when necessary. There is a pet clinic being scheduled in District 3, and that is out at Ojibwe, and there will be a spade and neutering surgeries by mid-snap, and there will be other vaccinations, and that is going to be September 4th. And there will be full wellness checks that include vaccines, dewormer, flea tick prevention, nail trimming, and also any kind of information or questions that you have with the vet. In Hinckley on September 18th, there will be surgeries and wellness checks. And that will be September 18th and 19th at the Mishawkwet Community Center. Call the community centers to sign up for surgeries. And the wellness exams are first come, first served. The annual District 1 clinic will be held the second weekend in November. Camp Ripley is having the open house, and they are honoring Native American veterans. And that is Sunday, September 19th, 2021, 10 a.m. to 2 p.m. And that is 15000 Highway 115, Little Falls, Minnesota. And we will put this information on the website. So if you or any of your relatives that are veterans want to attend, please go there. And again, we will have the information on the website. There is an exclusive training opportunity for Anishinaabe women. The Minnesota Indian Resource Center, We Are Still Here Minnesota, and Vote, Run, Lead are hosting a training for Native American women in Minnesota who are thinking about or interested in running for public office. At this training, Native women will have the opportunity to learn how to write and deliver a compelling stump speech to jumpstart their campaign. And so this is happening on Wednesday, and that's tomorrow, Wednesday, August 25th at 5 p.m. Central Time. And there is an exclusive training opportunity with Marisa Cummings from the Minnesota Indian Women's Resource Center and Ramona Kitto Stately from We Are Still Here Minnesota for the training. And you will hear from other elected Native American women about the unique challenge for women of color while leading in elected offices. So I am looking forward to that. I will be on that. And the trainer is Prairie Rose Seminole, and she is like outstanding. You will really enjoy her, very powerful. And I've known Prairie Rose for many years, and I look forward to that training tomorrow. So I hope that you have the opportunity to sign up for it, join it tomorrow at 5. We will have the information on the website. And with that, I would like to say good day, and I will talk to you soon. Miigwech.